I'm Martin Gerdes. I'm from Old Westbury, New York. There's an increasing amount of evidence suggesting that patients with heart disease have low thyroid function. In fact, it appears that heart disease in general, including ischemia, heart attacks, diabetes, and hypertension, all induce an enzyme that actually destroys thyroid hormones in the heart. And this may not be picked up in the peripheral serum. So there's actually quite a number of animal studies recently that show that, that thyroid hormone treatment of animal models of heart failure have beneficial effects, including, which is surprising, reducing arrhythmias. But what's missing, I think what's critically missing from this, one thing is we don't have a biomarker for the serum to tell if the heart is hypothyroid in different patients, because this may be the case even though their serum thyroid hormone levels might be normal. So what we decided to do is treat rats with heart attacks that we've induced surgically, of myocardial infarction, with very, very low dose of T3 thyroid hormone. Such a low dose it didn't even significantly elevate the serum levels of thyroid hormones to see if there is a significant benefit. And that's exactly what we found. In fact, we found improved function of the left ventricle, we found improved relaxation of the left ventricle, and quite a number of other important findings, including about an 80% reduction in the incidence of arrhythmias. We use a catheter to trigger arrhythmias in these animals whenever we sacrifice them in terminal experiments. And what we found was this very low dose of T3 actually inhibited dramatically the number of arrhythmias. So this is quite interesting, because one of the reasons that cardiologists are so afraid of treating patients with heart disease with thyroid hormones is that if you happen to overdose, that you might trigger more arrhythmias. Now I think this raises a number of questions, and that is that we've actually shown that low thyroid function is pro-arrhythmic too. We published papers on that. And now we've shown in several animal models with treatment of thyroid hormone that you can actually reduce arrhythmias by restoring cardiac tissue thyroid levels. So what's important about this study is it shows a clinically relevant approach that we can actually use in patients. If you give a low dose of T3 and look for a little bit of feedback inhibition of TSH and possibly T4, without even significantly raising the T3 levels in their blood, we've shown dramatic improvement in the results in these animals. And now this is coupled with a paper that we just had accepted where we treated hypertensive rats for a year with the same low-dose treatment, and we showed dramatic improvement there in diastolic function and also reduced fibrosis. And we published a paper last year with an animal model of diabetic cardiomyopathy, the same approach, a very low dose of T3, completely prevented all the heart disease. They still had diabetes, but they had no heart disease. So I think now this is exciting because we have a safe approach that we can use in patients to help restore normal thyroid function. And we have now outlined a plethora of really important changes, including a reversal of the gene changes associated with heart failure. So this is a really exciting time, I think. And I'm hoping that this cumulative body of work will very quickly start to trigger some interest in clinical trials.